Hello, everyone. I am Chris Ruhm with the Ruhm-Insurance Agency, a licensed independent insurance agent located in Cincinnati, Ohio. I currently hold a license of 15 states and represent a lot of insurance carriers. Today, I'm going to discuss Medicare Supplement Plan G versus Medicare Supplement High Deductible G. Medicare Supplement High Deductible G is not brought up a whole lot because it's a really low priced premium and we honestly don't make a lot of money on it, but it's a great plan and I think everybody should have a good understanding of it because it can save you a lot of money if you're healthy. So let's dive into the differences, but I'm going to first go over original Medicare with you. When you have a Medicare supplement, original Medicare always pays first. If original Medicare pays a claim, your supplement will pick up the gaps original Medicare does not cover depending on the plan selection. So today we'll be talking about G and high deductible G and those differences. So let's dive into Part A. Part A covers inpatient hospital, skilled nursing facility, hospice, and home health care. Part B covers doctors and outpatient services. We can go into a lot more about this if you decide to get a plan, but basically Medicare, original Medicare will pay first, and your supplement will pick up the cost that original Medicare does not cover. Okay? And then you can get a standalone prescription drug plan, which is recommended when you have a Medicare supplement. So Part A is typically free. That's what you've been paying into all your life. So if you've ever received a paycheck, that's what the Medicare portion is covering. You must pay for Part B and have both Parts A and B effective in order to get a Medicare supplement plan. So Part B for most Americans is $170.10. Why I say for most Americans, because there is an income-related monthly adjustment. So that's the IRMA here. So if you're a higher earner, you could pay more than $170.10. That's usually taken right out of Social Security. If you're not taking Social Security yet, you will pay this premium to them. So why would you want a Medicare supplement? Well, the number one reason to me is they provide predictable healthcare cost. You can see any doctor, hospital in the country that accepts Medicare. Plans are standardized across the country, so if you move, the plan goes wherever you go. You don't have to worry about switching to another plan. And it can never be canceled if premiums are paid. If a company gets out of the Med Supp business for whatever reason, you would get a guaranteed issue into another Medicare supplement plan. So let's dive into Plan G now. Medicare Supplement Plan G is considered the richest plan for anyone aging into Medicare after January 1st of 2020. If you age into Medicare before this date, it's Plan F. If you have Plan F, it's always a great idea to compare it to Plan G, and I can show you the numbers why it might make more sense to you. Original Medicare pays first with all Medicare supplements, as I mentioned earlier. With Medicare Supplement Plan G, it's simple. You pay your premium to the insurance company, and your only additional expense out of your pocket will be the Part B deductible for 2022, which is $233. So if you go to the hospital, that was Part A, you don't have to worry about this $233. Your original Medicare will pay first, and your supplement will pick up all A cost. Okay? So if you go to a doctor or outpatient service, you're going to have to pay the first $233. Once that's met, it pays 100%. So let's give an example here. These premiums are kind of, these premiums will vary by where you live. The premiums I'm using in this example are Cincinnati, Ohio. As I told you, that's where I'm from in the beginning. So let's pretend you had a premium of $120 a month for Plan G. That's $1,440 annually. So you'll take the $1,440 in premium plus your $233 Part B deductible. That's your worst case scenario, $1,673. No matter your health situation, you will not pay more than the $1,673 for all your Part A and Part B expenses. Now, just a reminder, your Part B premium is paid separately to Social Security. And again, most Americans pay $170.10. So you can factor that into both of these plans if you like. Now let's take a look at high deductible G. Medicare Supplement High Deductible G is the lowest cost supplement available. And that is why you may not have heard of this. Just to be transparent and honest, I make a lot more money selling Plan G versus High Deductible G because we make a percentage of the plans we sell. in my premium. So obviously I make a lot more on $120 versus the $35 that you're about to see. Regardless, it's an incredible plan for healthier individuals. The 2022 high deductible this year is $2,490. So again, Medicare pays first, and you will pay the first $2,490. It's important to note that Medicare pays very well and negotiates rates very well. So it's pretty difficult to hit the $2,490. You're going to have a pretty bad year health-wise. If you have a premium of $35 monthly, that's $420 annually. You add that to the $2,490 high deductible. Your worst case scenario with this plan is $2,910. So again, you have original Medicare with this plan until you reach the $2,490. The plan pays 100% after. If healthy, as I mentioned before, you can save thousands over a 15 to 20 year period versus Plan G. The $2,490 is lower than almost any Medicare Advantage plan out there as well. We're not talking about Medicare Advantage plans, but they are popular because of advertising on TV from like J.J. Walker of Fast Times or Joe Namath from the New York Jets. And then, as I mentioned in the beginning, original Medicare negotiates rates very well. So it's, again, tough to get that $2,490. And that's why I like this plan. All right, we're almost finished, and we're just going to summarize the two plans. Both make great plans. It just depends on your risk appetite and what you like for insurance purposes. Plan G is going to be ideal for people that want simplicity. They want to know exactly what their healthcare costs are going to be each month, and it tends to favor unhealthier people sometimes as well, because if you have a lot of chronic conditions, this plan is going to provide those predictable expenses better than any other plan out there. If you're willing to take a little bit more risk and you want to save a fair amount of money, high deductible G favors healthier people that understand insurance and high deductibles and want all the benefits of a Medicare supplement, but at a significantly lower cost. So this is great if you're really healthy, you're comparing it to a Medicare Advantage plan, or you just understand that this can just save you a ton of money, which I'm about to show you how next. So with a Medicare supplement, premiums typically will have a rate increase every year. So I took a compounding 6% over a 16-year period in another blog I did recently, and starting at $120 with Plan G, and I believe somewhere in the low 30s for high deductible G. If you compound 6% over 16 years, you save $26,795 in premium. So the likelihood of that happening is not realistic because you are bound to have issues come up and you will have some costs along the way. However, with the current $2,490 high deductible G, you would have to have 10.9 bad years out of 16 for Plan G to make more sense than high deductible G. Okay, 10.9 years. If you have 10.9 years that are bad, I hope you've made it, first off. And secondly, it was probably the wrong plan because you were unhealthy. So we probably wouldn't even be in this situation. So again, that's how I determine, help determine it. I know there's situations that we can never predict, but if you're going to have a lot of bad years and you know it, then obviously G is going to make more sense. But if you're relatively healthy to very healthy, you save a ton of money. And I do have a blog that goes into more detail on this exact situation. So one other important note about Medicare supplement plans, you can switch these plans anytime. However, you have to be healthy enough to switch. They do ask health underwriting questions after your initial election period. Your initial election period is typically 6 months following your Part B effective date. There might be other situations, but in general, it's 6 months following your Part B effective date. And last, I'm just going to show you a few additional resources that you can use with my agency. So we've made it to the end. Here are a few additional resources for you if you would like to get in touch with me. Of course, you have my phone number and email at the top. And then I included a few of my website pages, my Medicare, my blog, my YouTube page that has more videos, and then I get a quote option. If you would like this presentation in a PowerPoint form, I can send you it as well. So I thank you for taking the time to watch this today. I hope you made it through the whole presentation with me, and I look forward to helping you if you ever need any assistance with your Medicare solutions. Thanks a lot and have a great day. Bye-bye.